Look at this incredible chart. Now, this is a trend towards a shift in well-being, especially in reduction to anxiety and depression. I didn't want to use the word statistically significant as it didn't reach that threshold. But however, though, as you look at Weizmannia Coagulans BC99, a incredible probiotic, in its entirety, the picture becomes quite clear in relation to the benefits. Now, look at this trend, incredible as it is, not at that 0.05 level we like to see. However, no, now when we're taking other biological markers per se, as we see the common neurotransmitters, the anti-inflammatory marker, interleukin 10 in particular, and the stress-related markers, all reaching quite significant levels of improvement, it becomes quite fascinating. Pay close attention to interleukin 10 in regard to its relationship to interleukin 17 and the blood-brain barrier as we proceed forward in the highlights. But without further ado, let's get right into the study itself. The impact of Weizmannia Coagulans BC99 on anxiety and depression, 8-week clinical pilot study through the gut microbiota-brain axis. Once humans have, the backstory I should say, have mood disorders, the composition and function of gut microbiota can change, which is known as dysbiosis. Moving ahead, the reduction of gut microbiota diversity could inhibit short-chain fatty acid production, promote the production of intestinal inflammation, and affect neurotransmitter synthesis and metabolism, thereby influencing brain function and exacerbating anxiety and depression symptoms. This highlights the intrinsic connection between the gut microbiota and the brain, known as the gut microbiota-brain axis. This two-way communication involving the vagus nerve, immune modulation, and microbial metabolism plays a crucial role in regulating emotions, cognitive function, and behavior. As a result, the gut microbiota-brain axis has emerged as a promising target for interventions in mood disorders. Understanding mechanisms underlying the gut-brain relationship is crucial for developing new therapeutic approaches. Now, to proceed forward into those charts once again, beautiful, basically trend towards improvements in anxiety and depression. Quite impressive on the chart, but however though, we want to look at a p-value of 0.05. But however though, when incorporating the biological proof of what changed inside, those p-values at 0.001 become quite fascinating. The calming effect, the anti-inflammatory effect, and the stress-related marker effect as far as positive outcomes. Quite significant. Now, also, too, healthier gut. You see what I mean? You take the whole picture in. This looks quite impressive as far as for Weizmannia Coagulans over an 8-week period of time. That is just fascinating. An incredible increase over the placebo itself. Now, to go further into the study, this is what I want to highlight in regard to interleukin 10 and interleukin 17. A little technical, but you'll pull some of the keywords out, and it is quite significant. To proceed, the result was also confirmed by inflammatory cytokine levels. Interleukin 17 is a pro-inflammatory cytokine mainly secreted by, again, the cluster differentiation or CD4 and then T helper cells. But it could also be produced by other cell types such as the neutrophils, natural killer cells. Please forgive if I move a little fast. I want to get to the crux of it. Many studies have shown that interleukin 17 may be involved in the pathogenesis of mental disorders through the following mechanisms, such as activating cells to secrete pro-inflammatory cytokines such as interleukin 6 and 2 necrosis factor alpha, and destroying the blood-brain barrier and other pathways to affect the function of neurons and astrocytes, thus participating in the process of mental disorders. So this connection of destroying the blood-brain barrier, as you start to pull interleukin 17, it could connect to a ton of other potential health challenges out there where this BC99 can yield some positive results, potentially, without interjecting publisher bias. Interleukin 10 is an anti-inflammatory cytokine mainly produced by the central nervous system, such as the pituitary gland and hypothalamus, and has a variety of important functions in the human body, especially in immune and mood regulation. After BC99 intervention, the level of pro-inflammatory cytokines, interleukin 17, in participants was inhibited. The level of the anti-inflammatory cytokine interleukin 10 was increased and the body's inflammation was improved. Remember, a little while ago we did back in January a study in regard to BC99 in improving muscle outcomes as far as muscle strength and improvements. That could be part due to the reduction in these inflammatory markers. But just the same, let's look at the chart once again in regard to what we're looking at those biological markers. You see the connection and how interleukin 10 improving, correlating with interleukin 17 reduction, and restoring possibly integrity to that blood-brain barrier. Brain barrier. All right, you get the picture. All right, let's go to the methods real fast. There you have it as far as what we're looking at is compared to placebo. And now let's go to conclusion, and I'll show you a few more charts towards the end here, which may elucidate further details. These preliminary findings suggest that BC99 might alleviate anxiety and depression symptoms by regulating the level of neurotransmitters or the change of microbiota, which need further verification in subsequent animal or clinical experiments, i.e. people. All right, let's look at chart number 4, 5, and 6. This is a little brief explanation in regard to why those p-values are important, as well as putting the whole study in context. You get it right there. Leave it for a second. 2, all right, the key takeaways, without reiterating for the sake of time and expediency. You could pause it right there if you want to read through it. That's some of your key takeaways in this regard to the study. And for the medical professional as well, there's the data. Again, the DOI citation is always linked in the majority of the video channels this is presented on, so you always could bring it to there if you want to, but if you want a brief takeaway for the healthcare professional, there you have it as well. And just the same, here's a video we did back in January in regard to Weizmannia, Coagulan, BC99 as well, in regard to strength training. Again, pretty impressive. It looks like there's a lot of promise to this Weizmannia, Coagulan, BC99 coming across the horizon, especially if you begin to break it down into interleukin 10 and IL-17 and potential, without injecting publisher bias, protecting that blood-brain barrier. Incredible, incredible, incredible overall. Gratitude to the researchers. They did a wonderful job, as well as I look forward to see what you and I discover next week as well. Thank you for watching, and I'll catch you all next time. See you then. Bye.